everybody. My name's Toni Young. I'm the founder and executive director of Community Education Group. And what we're doing today is that we're going to be wrapping up our series on technical assistance and training for the Centers for Disease Control and Foundation's Home Test Kit Initiative. And today I've got with me Jen Hecht. And Jen, I'm going to read the name so I don't mess the name up, which I've been chopping up all week, which is Build Healthy Communities Online. No, I got it wrong already. Build Healthy Online Communities. I inverted the name, right? So, but I got it right this time.
Building Healthy Online Communities. Very good.
Give us the website where they can find out everything about your organization and about you one more time.
It's bhocpartners.org.
Perfect. Thanks. And what I'm going to do is I'm going to fade out and I'm going to let Jen tell us more about this organization, about the work they're doing in the home health test kit space and more. All right. I'll talk to you soon.
Great. Thanks for inviting me, Toni.
Thank you. Thank you for doing this. I appreciate it.
So here we are. We're going to talk about implementing HIV and STI home testing, and we're going to talk about our Take Me Home program. First, just a quick intro of who is Building Healthy Online Communities. Who are we? BHOC. We are a consortium of public health organizations that partner and work closely with dating apps to improve sexual health of people who use dating apps. And we have three main goals, as you can see here. First and foremost, we're focused on trying to build self-sustaining features into those dating apps and that promote healthy and informed choices. And then we also coordinate to improve advertising and messaging and work closely in our relationships between public health and dating apps. You can see here many of our public health partners and our dating app partners. And how did we get to working on home testing? So the way that we got to that was working with one of our partners, Emory University, doing some formative research. And we saw that in doing that, 22% of cis MSM who are using dating apps reported that they'd never tested for HIV. So that's a very high proportion of folks using dating apps who've never tested. We saw an opportunity there. We also asked some of those dating app users in this same survey, would they be interested in being able to order a self-test through a dating app? And there was a very high proportion of folks who are interested in doing that. So we saw that as an opportunity, and our solution was to create a ordering platform called Take Me Home. So we've been working in close partnership with NASDAD as well as Emory to implement this testing program. And here's just some basic information about how it works. We work with public health partners. Those can be health departments, those could be community organizations, those could be community service organizations. And they have been working with our administrative partner, NASDAD, in order to create a contract, order their kits. We then put those kits in our virtual inventory online. We work with our dating app partners to advertise that service so that it is free to the people in your participating area. Those folks are then able to order a test at no cost, and our partner then ships those kits directly to those participants. So importantly, there are factors to consider as to who's eligible, right? So we really try to keep that as broad as possible. We really focus eligibility based on zip code, age, and time since last test. And that's something that can be tailored at the organizational or jurisdictional level. So here's a bit of what it looks like. You can see it here on a phone, which is how most people are accessing testing. And that's because our dating app partner will send a message. They're usually on their phone on the dating app. They get a message. They click on the message. They get to our site. They're able to order a test. We make it as welcoming, friendly, easy to use, very quick. It takes about 30 seconds to a minute to order a test. One thing that's really important is that we really ensure that when sending the test, we're sending as much information as possible. So in many cases, we're sending that OraQuick kit. The OraQuick kit does include, instructional information, instructional video, a 24/7 hotline. We also include additional customer service and support, as well as information that's both sort of national directories and locally tailored resources for our participating jurisdictions. We have found that users are so excited to be able to participate in a program like this. They really feel that they have discretion, they feel a level of comfort. And so we get a lot of really positive feedback. For many, this is their first time testing. Very quickly, I just want to touch on some best practices that we've identified in working with our partners. That can be promoting locally with free social media assets, It can be allowing users to be able to order up to 2 test kits, tailoring eligibility criteria to local needs, allowing users options through multiple packages, which I'll talk about in a moment. And then this is for the lab, being able to check your lab portal, as well as being able to complete surveillance case matching. And finally, creating a dashboard. You can see an example here from Oregon. So just want to highlight that TakeMeHome was featured in the MMWR in 2021. And part of that has to do with the fact that we found that over 1/3 of our participants reported they'd never tested before. So what we're finding is this model of partnering with dating apps to get information out to communities of people who've not tested really does engage new communities of folks who were not otherwise accessing testing. Finally, I'm going to talk very, very briefly about other testing aside from HIV, the ability to do self-collection for STI testing. We work with health departments or, again, community-based organizations about which packages they want to offer, and that allows participants to, they may have more than one option to choose from, excuse me. In that situation, a participant would create an account, they would collect their specimens, mail them in, and return them, and then be able to return through the portal to look for their results. In that case, health departments or community-based organizations are required to provide medical oversight. So we have 3 specific packages that we offer. I won't get into those details right now, but you can see right here what that looks like. And also we have some different models that can be used for implementing TakeMeHome. So that can be with, our main model, which is, leveraging the dating apps to reach new individuals. We can also do a clinic-based model. This model can be used incorporated with DIS or with navigators. And finally, just to talk briefly about promotions, this is such a big part of our model. We regularly promote with dating apps that we partner with, including Grinders, Sniffies, Pause Personals, and many others. And we also encourage our local health department and other partners to promote through their channels as well. We offer free digital media assets and printed assets for folks to be able to distribute. Here's a couple of examples of those. And finally, just a couple months ago, we launched a national home testing program that was in partnership with Emory, NASDAQ, and other partners as well. That launched in March, and that is allowing us to have an expanded customer service team, which is also offering referral and linkage to additional sexual health services. You can find that at together.takemehome.org. Thank you so much, and I hope that this information has been helpful.
Let me tell you, it was super helpful to me if it wasn't helpful for anyone else. So thank you for doing it, because I learned a lot. I didn't know about the tie-in actually of how you, Emory, and other partners are working together. As I said earlier, one of the things that's happening is that this project that CEG is doing is coming to a close.
Yeah.
And so one of the things I wanted to talk to you about is and I don't know if you can or not, and so let's just talk about it very honestly and directly, is that these 50 organizations had also small grants also with CDC Foundation, not CDC, but CDC Foundation, to do just distribution locally or in their catchment of home test kits. Is this something they can now come to you and be a part of your program and say, hey, our program's wrapping up. We've got this, for lack of a better term, customer base that has been getting these home test kits. Is there some kind of way that we can either introduce them to you, partner them with you, do a bigger webinar with you so that they don't lose traction? Because I think that home test kits are one of those things that once people kind of get it in their brain that they can do it, then they're more likely to do it. But I'm going to let you talk this up, Toni.
Yeah, absolutely. So I think that, you're pointing out something very important, which is that home test kits have been around for a while, right? But they've been underutilized. And I think there have been a few reasons that they've been underutilized. One is that people didn't know about them. They were expensive, and they didn't know where to get them, right? And there wasn't one easy place to get them. So, I think we're, as a group, many of us are working toward helping make sure people know about them now, right? So you've already touched on that. Many of these community service organizations have now been working with their communities and they're letting people know about it. The second thing is that if it's free to the participant, right? That's important, because going to spend, upwards of $45, $50 at a pharmacy to buy a kit, or even online, that's expensive. So to that end, I think there's a couple different ways that we can help. If these community service organizations have a budget, they can absolutely sign on to work with us. We would be happy to do so. They can get more information at that bhocpartners.org. And then additionally, if there is no budget, there's another option, right? Which is that we did launch this national project funded by CDC, now in partnership with Emory and other groups, right? And so that enables anyone to be able to order a kit who's age 17 or older, right? In the US, I think. So what local organizations can do is they can help promote that. They can promote that this new resource exists. And so I think that's a huge option as well. Right. We can talk about that some more. So far, we're having so much success that the kits are going really quickly. So we have to talk about that. But that's definitely an option for these groups.
Let me jump in, because I know I can see particularly two organizations that I'm thinking of that are CSOs now, right? Mm-hmm. All right, so let's say I'm organization A, organization B. Sure. Organization A was a part of the foundation program, did a great job, but used its budget from the CDCF. And it doesn't have any more money, but yep. Like I said, it has this list of people and opportunities for promotion. Yep. Then I'm organization B. Organization B maybe has a little budget. I got maybe 5 or 10K. That's all I really had in this line item for that. Yeah, I'm organization A. I go to BHOC blah 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 blah.com or .org, and I go to your website. Let me just say it that way. I go to your website, and I want to be a partnering organization. What do I do? What do I say to you with no money? And so you're going to give me what? I think you're going to give me materials to help me promote your program and that sort of thing. Is there any way for me to localize what it is you're doing?
Yeah. So with organization A that does not have a budget set aside for this, they would be absolutely encouraged to promote the together.takemehome.org link and cite that resource, right? And so, yes, what they would do is, and we could start out by contacting me, and I can ensure that they get connected. What we would do is create a specialized, what we would call a UTM code, or a specialized link, that when they put out their information and they put out all the resources that they're going to do digitally, that they can then be able to track, how much came from their own efforts, right? And I think we all want to be able to do that, right? Both on the part of the sort of national program, we want to be able to know where the tests, where's the traffic coming from. And then the local program, of course, also wants to know, hey, we're doing all this effort, we're doing all this outreach, what's that leading to? So that's the best way of doing that is, reach out to me, Jen Hecht at bhocpartners.org. I shared that in our last slide there. That is the way to ensure that those resources, that can be tracked in terms of those kits. Yeah.
Okay. And so I'm organization B, and I don't have a lot of money, but I got some money. Yeah, like I said, I got a 5 or 10K, money I stuffed in my sock. So how am I, and I wanna get some home test kits. Sure. Can I come through you? Because historically they'd bought them from us. So can I come to you and buy some test kits?
They can come to us. What we'll do is set them up to be sort of then participating within our TakeMeHome.org site, right? And they can do one of two things. They can either continue to do and sort of complement OraQuick kits, which we have many organizations that are continuing to do because they recognize that the demand is very high, and so they can support additionally kind of what's happening at the national level, right? And we would work with them to then tailor resources. We would work to them to say sort of which geographic areas do you want to cover? And we would work with them and enroll them kind of in our main program. And if they're interested in having beyond the sort of OraQuick and doing the lab testing where they could also do STI testing, we can also work with them on that.
Wow. Okay. So you are probably a logical next step for these 50 plus community serving organizations, no matter if they fall into category A, no budget, or category B, because what you're saying is, and I just want to make sure, this is, I
Yeah.
feel like it's like couples therapy. I'm repeating back what I think I heard. I am thinking that you're saying if I'm organization B, I'm wrapping up CDC Foundation, I've got no money. What I can do is come to you. You'll give me a link that I can put on some promotional materials. And then that way, maybe I don't necessarily lose traction of the folks that I've already kind of built up
Exactly.
this
Yeah.
relationship. I could send them a follow-up email and saying, hey, we're not doing our program, but we're partnering with these folks. And that's one question I want to ask you too. If they get this link, sign up, can they use language like partnering with, collaborating with, in kind of promotional materials that they're going to be putting out? Because I think that kind of thing helps. We have big fancy
absolutely.
organizations like yours that are doing this kind of work, right? You got Emory, we got you, and these small organizations. So I think we want to really be able to say that these small organizations too are partnering with big organizations nationally,
Right.
like yours.
And if we're talking about the national program and the folks that don't have a separate budget line, then they're also, that's a CDC funded program. And so that is, that also has some credibility in some circles, many circles, we hope.
Right.
But yes, absolutely. I think that's a good idea. I think they can definitely, use that terminology and do the kind of what we would maybe call like a warm handoff, right? So it's like, we've built these relationships, folks, we've built credibility. That is so important at the local level, building that kind of credibility and connecting with folks in a way that, it's much harder to do at the national level.
Right. Well, Jen, I want to take a couple of minutes. First of all, just say thank you for doing this and taking time to share this with us and with these CSOs. But I also want to take a minute because I think that people who may watch this and want to participate in this, where did y'all come from? Tell me about this organization. How long has it been around? Where did y'all come from? How big is it? I know, it might just be you and your cat, but,
Yep, pretty much. We are, So we're a consortium building healthy online communities. We've been around formally since about 2014. And as I said, our primary work has been in building relationships with dating apps. So we actually started, my co-founder and I, Dan Wolfeiler.
So for those of people who don't know, Dan used to run what I don't even know what you would have called it back in the day, because it wasn't like a really listserv. It wasn't really a news. I don't know if it was a newsletter per se, but I'm going to tell you, he had a way of synthesizing data, information, reports, updates in a way that kept us all focused.
Yes, I received that for many years. And Toni, I will be sure to share that with him when I speak to him next, which, as I said, will be tomorrow.
Right.
So yeah, I think so Dan and I started this project about 15 years ago. In about 2009, we started doing some sort of formative research to understand, like, how do we best work with dating apps? That then led to a report that we put out, a convening with a number of dating apps, which at that time actually were websites, some of which then, many of which became apps, right? And that during that convening, what happened was we realized there was some momentum, right? That these websites and apps really understood, they wanted to support public health, but they didn't know how. And so they needed a structure. And so BHOC, Building Healthy Online Communities, has become that structure to help support how do dating apps who really want to help support the sexual health of their users, how do they engage? And so we've really played the role of gathering information from public health, from dating app users, and then working with dating apps to implement that. So that's what we do. And as I said, that is how we came into home testing, because we learned and again, we partnered with Emory over many years in some of our more academic or, survey-based research, that when we talk to and we gather information from MSM who use dating apps in particular, that we were seeing there was such a high proportion of folks who hadn't tested, and there was this huge opportunity. So that's who we are, and that's how we came to be. And as I showed on that slide, we have a lot of public health partners at the national level, some local level folks as well, and a lot of membership organizations that we work with to make sure that we're really bringing all of that sort of expertise forward.
The other thing I want to talk about, though, is you listed Grindr never heard of sniffles in my life. I'm
Sniffies.
not
Sniffies. They might
sniffies.
be insulted if you call them sniffles. I don't know.
Oh, sniffies, not
Sniffies.
sniffles.
Yeah.
All right. I think Sniffles was a mouse, a cartoon character. Um, I mean, so my question is this. One of my goals, one of my targets with the CDCF project was really making sure that we got the idea, the concept, and the actual kit into the hands of folks, particularly folks that have African American, but African American women, heterosexually identified couples, or couples that maybe discordant HIV related couples, that kind of thing. So, but
Yeah.
particularly in the African American cisgendered
Yep.
space, because I think that they often get left out. Like even your program is really seems to be focused in on
Yes.
you
And
said
I want to,
yeah, but what
yeah.
about Bumble,
Let's talk
Hinge?
about that.
Yeah.
Absolutely. So I think there's a couple things to say about that, and I'm glad you raised that, because that is absolutely true. We have traditionally predominantly focused with MSM and worked with MSM apps, and a lot of the gay serving LGBT apps. Those apps, in our experience, have been, and a lot of this comes from the users of those apps who are saying, and that in the open-ended fields, they're putting they're putting their HIV status, or they're putting them on PrEP and all this stuff, which is how, in our work, we have advocated and worked with many of these apps to start including those kinds of profile fields. So those apps have sort of a very high level of comfort with sharing a lot of sexual health information, right? That is a part of the sort of, you sign into the app, you immediately get to put a lot of this information, and it makes it easier when folks meet up if they already have some base information about who they're wanting to meet up with, or makes it easier for that next level conversation. And where we are now is, first of all, in the project, as we scale up nationally and work with CDC, working with cis Black women is one of the new priority groups. So trans folks, cis Black women, and MSM, particularly MSM of color, right? So those three priority groups. So we're really excited, as sort of having begun this project, to be able to scale and add in additional priority populations. I think that's huge. At the sort of more local regional group project, TakeMeHome.org, what we do, because we have typically had these relationships with apps in the LGBT community, there's sort of two things we're doing. One is that we work with our local partners to ensure that they are doing some outreach in those other communities, and we provide those digital assets that are very wide ranging in terms of kind of images. We've actually done a whole project around image inclusiveness, and you can find that on our website as well, that we encourage you to check out. So that's an important sort of complementary part. And as I noted, in terms of eligibility, you don't have to, you don't say anything about your, sexual orientation, sexual behavior in terms of eligibility, right? So it's open to everyone, right? And that's really just based on geography and age. So that's an important point. The second thing is we are starting and building up relationships with other apps. So we've been meeting with Tinder, we've been meeting with OkCupid, we've been meeting with some of these other apps that serve, a wider, range of folks in terms of sexual orientation and background, and that is really important. And so we're starting to build that up and move in that direction. And it's a different conversation, because those apps, some of them are set up differently. They don't tend to sort of lead with sexual health information. But we recognize this information is very important, and we're working on having those conversations around, some of them do still have some sexual health resources, and we want to make sure they have resources that are available for everyone. So that's definitely a big part of it as well.
Perfect. So again, let's play, couples therapy 101.
Yes, please.
Let me mirror back. So what I'm hearing is that for this effort, it looks like it's over 5 years with you, other partners that are going on. Sounds like your goal is to have, over the course of 5 years, 1 million kits distributed throughout the United States. Sounds to me also, what I'm hearing you say is, yes, this has been about the dating apps, and then there has been a focus that are on what was on men who have sex with men and on those particular sites, but that there is now I don't want to say a shift but an added sense of priority for Black women in particular, and all cisgendered Black women, also Black trans women or trans women generally, is what I'm hearing. but also keeping the eye on the prize around men who have sex with men as well.
All right. So the first thing to know is bhocpartners.org. That's where kind of our main website. And on that, you can find the information about this home testing program. You can see our contact information here. Toni, as you noted, we are very small. It's pretty much me and my cat. And we've got Emmett as well, who is an amazing partner and supporter of this work. So that's who we are. And yes, please look us up and we'd be happy to connect you into some of the other services that we
Well, that's just swell. I really do want to thank you. I feel like, what I'm realizing too, Jen, how long are you in the Bay Area, huh?
I am in the Bay Area, yes.
I must have met you or known you when I was there, because I mean, that was a period. I mean, but that was a long, but yeah,
I've been around for a while, Toni.
I
I
think that we probably, I mean, we have to have cross paths at some point. And, what I tell people now, kind of looking around the country and looking around the world, really folks that are committed to continuing the work of HIV prevention, education, research, and treatment. This is not for the faint of heart. This is, people do not do this because they end up uber rich or uber wealthy. They do this because they are sound and strong and stalwart, I think, public health advocates. And so what I want to do is thank you, and particularly thank you for your work over all of the years and all the decades. I think sometimes we forget to, look at our champions right in the face and say thanks. I appreciate the work that you've done. I appreciate the work that you're doing. I don't think it's over with, but I just really have just gone through kind of the last couple of months where some of the folks that have done this work have, literally died at their desk, being the advocates that they are. But I wanted to just say to you, thank you. This wasn't easy work, but it was very necessary work and very right on time work, because I think many of us, and myself included, takes the occasional stroll down App Lane. And I think that this seems like a perfect matchup, a natural partnership. Again, thank you, thank Dan, thank all your partners for us, and we will certainly share this information with all of the community serving organizations that we have here at CEG, and strongly encourage them to become partners. As you pointed out, the data piece on this is built in, so I think it's a low barrier for a lot of folks. But again, thank you so much, and thank you for the opportunity.
Thank you.